Retainers and expanders.
What is a retainer?
A retainer? After braces, teeth have a tendency to return to their original position, a phenomenon called relapse. Maintaining the corrected position of teeth is just as important as the treatment itself. A retainer is used for this purpose.
So, is it fixed inside the mouth?
Some are, and some aren't. Retainers are broadly divided into fixed types and removable types. A fixed retainer is a wire attached to the back of the teeth to prevent movement. It's there even when eating, so checking the bite before making it is important. A removable retainer, as the name suggests, can be taken out and put back in. The most common types are the Holly retainer and circumferential, wraparound retainer. There are also clear retainers, but they have a shorter lifespan than resin retainers and cover the biting surface, which can interfere with bite stabilization. However, they are very good aesthetically. Also, depending on the occlusion condition and shape of the teeth, retention may not work. So a modified retainer may be used. Adams Circum, Adams Wraparound, Modified Wraparound. They look complicated, but they are all the same device.
It seems a bit crowded.
What's crowded?
The arch is severely crowded. We might need to use an expander.
What is crowding?
It's a condition where there's not enough space for the teeth to erupt evenly. For example, imagine trying to fit 14 people straight on a narrow plank. Some will stick out, some will only be half on, and some will stand sideways. What do you think should be done in such a case?
Remove some people or widen the plank.
Exactly, that's necessary. The human palate originally develops as two separate bones that fuse into one, forming the mid-palatal suture. As you age, this suture becomes more rigid, so it's best to expand it before adulthood. Therefore, for adults, fixed appliances like bands are often used. In mixed dentition cases for children, removable appliances are more common. However, it isn't always the case, as various factors like age, arch form, occlusion, and dental alignment determine the appliance used.
What types of fixed appliances are there? Do fixed appliances apply constant force?
Yes, since they are fixed in the mouth, they apply continuous force. That's why they are called rapid palatal expanders. To make them more effective, there's also the MARPE, which uses mini screws. But in your case, we don't need extensive expansion, so a removable appliance should be sufficient.
What is a removable appliance?
As the name suggests, it can be taken out and put back in. The screw expands to create more space.
What are the advantages of removable appliances?
The main advantage is that they can be removed, which makes them easier to clean. They also allow for rest periods without constant pressure. However, this can also be a disadvantage. They can be easily lost, and if not worn consistently, they won't be effective. If you stop using them halfway through expansion, the teeth can revert to their original position, causing the appliance to no longer fit. In such cases, you must visit the clinic to have it checked and readjusted. Also, dogs often like the saliva smell from the appliance and might chew on it. So if you have pets, be sure to keep it safe.